Welcome back, you all. We welcome you all on the behalf of whole Eternal family on 10th International Conference. Thank you all for giving us your valuable time. Thank you. So, without wasting our time, now we are going to start our scientific session, session 3. And for the session, the topic of the discussion will be a call to action, advanced forensic nursing in India and globally. And this topic will be discussed by Dr. Jaideepa. Ma'am is officiating principal in IQ City of Institute of Nursing Science, Durgapur, West Bengal. Madam is having BSc Nursing, MSc Nursing with specialty medical surgical. Madam is also having PG diploma and MBA in hospital management, PhD in nursing. Ma'am has also done national program on technology enhanced learning. Ma'am has published a textbook on critical care nursing. Ma'am has worked on more than 15 research projects. Ma'am has more than 25 paper publications. Ma'am has presented more than 30 papers. Ma'am has attended more than 100 national and international conferences, webinar, seminar, and workshop. Ma'am has more than 10 professional membership, including Sigma Theta Tau, International Honor Society of Nursing, International Network for Doctoral Education, TNAI, Oncology Nurses Association, and Nursing Research Society of India. We welcome you, ma'am.
Our chairperson for the session is Dr. Binu Joy. Sir is working as principal at Christ College of Nursing, Christ Hospital, Gujarat. Sir has done BSc Nursing and is gold medalist in MSc Nursing in Child Health Nursing, MBA in Hospital Management Administration, PhD in Nursing, and also has diploma in Naturopathy and Yoga. Sir is having more than 17 years of experience in the field of nursing. Sir has published over 20 papers in various national and international journals. Published textbooks of child health nursing for GNM students, textbook of nursing in research and statistics for BSc nursing students, as well as cumulative record book for BSc nursing students, and also the solved question booklets. Sir has membership of various professional bodies. Sir has been a resource person in more than 10 state level and more than 13 national level conferences. Sir has more than 5 paper presentations in national level conferences and also editor of more than 5 national and international journals. We welcome you, sir. And second chairperson for the session is Professor Samriti Arora. Ma'am is currently working as professor cum principal at College of Nursing, AIMS Rishikesh, recognized as PhD nursing guide at INC, and has work experience of more than 20 years. Ma'am is BSc Nursing, MSc in Pediatric Nursing from College of Nursing, AIMS, New Delhi. Madam has course certification in traditional Chinese medicine. Ma'am has worked at Amity University, Haryana, and Jamia Hamdard. Ma'am has been honored by Indian Academy of Pediatrics for her contribution in basic newborn care and resuscitation program. Ma'am has published over 2 books and has more than 250 citations for her publication in various national and international journals. Ma'am has participated as national trainer for COVID-19 pediatric care, NRP HIV/AIDS, and national mentor for nationwide quality of care network for quality improvement under Lakshay and Muskan program. We welcome you, ma'am. Now I request our resource person, Dr. Jaideepa ma'am, to kindly begin with the session.
Good morning, dignitaries on and off the dais. First, let me express my thanks to the Almighty God for bringing me to the stage. And thank you, the organizers, for the opportunity given to me. So I'm asked to take a session on a call to Advancing Forensic Nursing in India and globally. A warm greetings from the IQCT Institute of Nursing Sciences, Durgapur, West Bengal, a unit of IQCT Foundation. At the end of the session, I expect the participants determine the need for forensic nursing services, define forensic nursing, list out ABCs of forensic nursing, and explain the advancing forensic nursing in terms of education, practice, and research, enumerate the consequences of forensic nursing services, and list the capacity building activities. So with these objectives, I start my session. It's a day of a life of an investigator in a crime scene. All of us, one or the other way, have gone through some crime novels, crime movies. So the reading novel, watching a crime movie is really thrilling and interesting. We will start with some assumptions. At the end, it may be something different. The conclusion has come with a scientific investigation behind it. So more or less the same work only is done by the forensic nurses also. So how interesting to read a novel or watch a crime movie. Same interesting the work of a forensic nurse too. You will learn. There are lots of opportunities in it. I would like to present the data regarding crime in India. Actually, day by day, the crime rates are increasing. That is why there is a need of more scientific and trained professionals to deal with it. It's just a fact which had come from the National Crime Records Bureau report in 2021. So if we see the difference in the data from between 2020 and 2021, which shows there is a increasing trend of crime in India. Crime rates affecting the human body was 77.4 in 2020, increased to 80.5. Crimes against children increased to 33.6 from 28.9. Juveniles in conflict with law had increased to 7 from 6.7. Crimes or atrocities against scheduled caste 25 to 25.3. Crimes or atrocities against scheduled tribes from 7.9 to 8.4. And cyber crimes were also increasing. It had increased to 3.9 from 3.7. Offenses against the state, there are totally 5,613 cases in 2020, but which has reduced to 5,164 in 21. Murder rate was 1.6 in 2020 and 1.7 in 2021. There are some more statistics which I would like to present. In India, there are only 3.33 forensic scientists per 0.1 million population. Whereas in abroad, it is 20 to 50 forensic scientists per 0.1 million population. So there are around 80 universities and colleges. They are conducting forensic science and risk management courses in India. The pending cases in forensic lab, in 2005 it was 0.5 million. In 21 it is increased to 0.7 to 0.8 million cases. There are various factors which are for this increased pending cases. One among us, lack of workforce. And around 50 to 60,000 unidentified dead bodies are brought for DNA analysis for every year. So as per 2020 data, there are 64 independent postgraduate institutes of medical education and research, and 554 recognized medical colleges are having forensic departments. As per NMC norms, Department of Forensic Medicine is essential in all medical colleges. So it is there in every medical college. Doctors are trained in it. So those who had an opportunity to study in a nursing college attached with medical college had an opportunity to visit the forensic department, had an opportunity to see the postmortem cases, have some knowledge of forensic science. Whereas for others, so far, there is an opportunity for them to learn this. So what are some of the problems with forensic evidences in India? Actually, the verdict just is depending on the evidences which is produced in front of the court of the law. But we have some lacunae, we have some factors which are questioning the trustfulness, worthiness of the evidence. They are erroneous convictions based on the faulty forensic evidences. If the evidence is fault, again the convictions also will be fault. And most investigating officers are not adequately trained in collection, preservation, packaging and forwarding forensic evidence due to lack of education and training. The most important part in forensic services are collection of evidence, preserving it and how to send it. So when there is any problem in these steps, definitely that will affect the further steps in the process of judgment. And lack of scientific auditing at crime scene. So we don't have a proper auditing system of crime scene reporting. Other factors, lack of scientific certainty. There are lots of developments have come. So we need to follow the latest techniques and there must be scientific rationale behind things what we do. There is lack of research. When I was searching for preparing this presentation, to be frank, there are very less number of articles on forensic nursing. And most of the articles were written by Dr. Goria sir only. So when we do that research, not much authors in that. Whereas in forensic medicine, there are thousands and thousands of articles on forensic medicine. And forensic sciences as having very low resources as I explained now. And there is lack of well-defined code of ethics for forensic nursing. We have a code of ethics for nursing practice, general nursing practice. Whereas for forensic, it is not there. Lack of certification experts. Actually, the evidence is produced has to be certified. We don't have much persons to do it. And not much reliable database available. There are there, but very minimal. And non-availability of error rate statistics. So these are all the factors which are questioning the evidences which are submitted. For effective forensic case management, two essential things are required. First is policy. Any work undergoes under the policy. So policies are directing the process. Accordingly, the work will be done. So we need to have a policy on it. Then legislation to ensure protection of patients, legal, civil and human rights. So anything, whatever we do, we are working under the boundary. This practice is guided by the law. Everyone have the legal and ethical implications of it. So the legal regulation should be very clearly defined to protect the human rights. Coming to the point, forensic nursing. Forensic means pertaining to law. Whatever we do under this, we have to do within the limitations of legal system. And forensic nursing is application of nursing process or nursing science to the public or legal proceedings. So we will apply the same nursing process, whatever we do in a healthcare setup, in a legal setting. So it has four major concepts of it. Nursing knowledge, what is actually gained through our undergraduate, postgraduate and other courses. Forensic nursing, it is forensic science, it is a typical science on forensic related things. That component also will be applied in forensic nursing. And it is working with the criminal justice. So these four components, nursing is a borrowed science. Many concepts from psychology, sociology and other fields are borrowed. Similarly, forensic nursing borrows the concept from nursing knowledge, forensic science, justice and forensic medicine. So it's a definition of forensic nursing given by Lynch in 2004. Application of nursing process to public or legal proceedings and the application of forensic healthcare in the scientific investigation of trauma or death related to abuse, violence, criminal activity, liability and accidents. So this is the definition of forensic nursing. It means application of nursing services in a legal or violent setup. That violence may be due to many reasons. So this is the definition of forensic nursing. The qualifications on which the forensic nurses are getting into practice include, there are certification courses, they just do that certification courses, and there are so many online certification programs are also available. I am not sure about the acceptability of these certificate courses. That is one way by which forensic nurses enter into practices, or taking training in the forensic department, and they can become. Now the basic education, only recently INC had introduced forensic nursing in the BSc nursing curriculum. So those who are passing out with this new syllabus will have a basic idea of forensic nursing. Then advanced practices like PG courses, PG diploma courses. These are all the ways by which certifications can be gained. Forensic nurses can enter into practice side. Some of the interesting things about forensic nursing I would like to present here. ABCs of forensic nursing by McRacken. A is for assessment of the victim. Usually we do assessment of patients. Here the assessment of a victim is done. B is to bridge the gap. That means making or acting as a liaison between the law enforcement and the medical examiner. C is for chain of custody. The methods of evidence collection, establishing continuity of evidence, possession and disposition. So evidence is very important in forensic science. How far we are able to collect the evidence, how far we are able to preserve it, protect it, submit it. So that comes under, that is called as C, chain of custody. D for documentation of finding. As nurses, we know that documentation is very essential. Everywhere, documents only speak. So D stands for documentation. E for evidence. F, families, keep them informed. So in forensic nursing services, it is not only focused about the victim, it is about the family also. So take care of the families too. G, going to court, like be prepared to provide written and oral testimonies. Nurses' testimonies, nurses' reports are accepted. So going to the court is G. H is hospital policies. Know where and how to access your institution forensic protocols. Institutions have protocols for all the procedures. Similarly, for forensic cases and its management also, institutions will have protocols. So you should be aware of how to access these protocols, and you have to act according to the protocols. I for index of suspicion. Be aware of signs of abuse and violence. So these are all the ABCs, it was interesting when I was reading. I thought I will present it. So this is about ABCs of forensic nursing. What are the global strategies for forensic nursing services? There are some new strategies for health and justice, that is including forensic nurse, court-ordered evidence recovery from the suspect, accused and incarcerated offender. So it gives an opportunity, job opportunity for the nurses. Since they are having some basic qualifications, they can be better utilized in this service. So inclusion of them in the court cases will be a better strategy, because we have seen the lack of accuracy in the evidence. So to some extent that problem can be solved when nurses are involved in it. Then inclusion of forensic in the trauma team. When I was reading a trauma team, forensic team, actually in the literatures I could not found a nurse in that team. Actually including them also will be a better strategy for better forensic services. This is a forensic nursing model. Yesterday sir was telling more about Virginia Lynch. Actually she started the concept of forensic nursing. So this is a model for forensic nursing education, So if we see there is a triangle in the middle, on the top of the triangle there are three circles given, that is forensic science, nursing science, criminal justice. This talks about the educational aspect of forensic nursing. When you come to the left side of the triangle, social sanctions, human behavior, crime and violence. How the society is accepting crime and violence, how they are treated, the societal aspects of accepting, rejecting the violence or victims in a society. That talks about that. If you see the right corner of, there are another forensic nursing and healthcare. That means the forensic nursing services are provided within the healthcare system to the victim and the offender. So these are all the three concepts which is mentioned in the triangle. If you see in the middle, there is a caducus which is attached with the symbol of justice. So that indicates the symbol of forensic nursing. The lamp fire which is over that indicates to create an awareness of forensic nursing to the community. So if you see, everything is encircled with two circles. There are so many factors written in it. It shows that it is a multi-sectoral approach of involvement of experts, education, prevention, healthcare system, society, culture and politics, social impact, sociology and criminology. So these stakeholders must be involved in educating nurses on forensic science. So this is what the forensic nursing model says. So when we teach or educate our children on forensic nursing, we have to follow this model to educate them. So this profession is noble as well as nursing, and it is a thrilling profession. If you see a life, there will be no boring day. It's full of thrills. Like I said in the first, like reading a crime novel and crime movie. So how there are some existing shortcomings. To list out that, first is workforce resources. In every field we have shortage of people only. Unless we have enough people, we can't achieve the objectives. And forensic science education also is a shortcoming. Some initial steps are taken now, so we have to wait and see how far it goes. Technology and instrumentation. Truly we are lacking many advanced techniques and technology. So we have to go for a long way. Yesterday, sir was showing the pictures of mortuaries in India and abroad. Just an example, how far behind we are. Again, condition of mortuaries. The legal provisions. We all know the legal proceedings in India is a time-consuming process. It takes much time. So there must be something to be done to get justice fast. That is actually the need of the hour. So I am asked to present the strategies at India and globally. I put the strategies in three classifications: in education, practice and research. So to improve or to advance the practice of forensic nursing services, what to be done at education level, what is to be done at practice, what is to be done at research. So for education, there must be uniform standard education. That is the mandatory. I just put it in one word. Practice, defined scope of practice for forensic nurses are essential. Research, R&D activities. So I will present in detail what is to be done in education, practice and research. Forensic education guidelines. First, we have to assess the minimum level of instruction required to ensure patient practice. What is the minimum level of qualification required for a nurse to enter into forensic services? Define the patient population to whom these services are going to be provided. Establishing minimum duration for the courses. So there are durations. There is 1 month online course, 6 months course, 1 year course, 2 years course. So we will have to establish a defined period of education. Provision of trainers. very important point which was stressed, because in this year only it is introduced in the 5th semester. So maybe another 2 years are there for us to teach the students. So this 2 years, all the teachers who are going to teach forensic nursing have to be trained. No, but none of us have learned forensic nursing in our curriculum. For UG, PG, PhD, we did not. So like how there are so many training of trainers are there, this also has to be taken as a mission. All teachers must be trained. Without teachers know, what will we teach to the students? So we must be trained. To be frank, the main aim of coming me to attend this conference is I wanted to learn. Because I have to teach after 2 years to my students. So this is the first aim, what made me to come here. So this is very important. All teachers must be trained. The training must be of uniform training. Only then there is no difference in teaching takes place. So this is a very important point which I take this opportunity to express my concern over this. Training of trainers at this point is very, very essential. Scientific recommendations for clinical preceptorships. Like this training can be conducted through CNEs, workshops. This is for the teachers, I say, but already those many number of nurses are working in the hospital setup. So they also must be given education or knowledge on forensic nursing science. There are so many research studies on forensic nursing which assess the knowledge of nurses on students, nurses in the practice setup. Every study says that they have lack of knowledge in forensic nursing. Obviously it will be because we have not studied it. And role of medical colleges in training the nursing staff. As I said earlier, all medical colleges are having a forensic nursing department. They can take this as a mission in training existing people on it. So I would like to quote one example here. Actually, there are so many, the suicide among the students are highly prevalent now. Our health university up with a all the medical college department are given this assignment. Colleges in the state are assigned. They have grouped geographic location wise. Just okay. So we are deputing the teachers. They are going to the medical colleges. It's a 1-week training is given. Medical colleges took this as a mission. Similarly, medical colleges with forensic department should train at least nearby people on these services. And establishing forensic lab in college. So this regulation can be given. We have so many labs. Not much also can be done. At nursing college, if the students have to learn the theory, there must be some set learn the effective oral and written communication training to deal with victims, family, and the team members. So communication is very essential for nursing, whichever aspect of sub-aspect of nursing is. Whereas in forensic, very important because there are records, valuable legal records. So we must be trained on it. Educational guidelines. Some important teaching, learning, pedagogy curriculum that in inquiry. It's an inquiry subject. How to do that inquiry, like interaction, learning, observation-based learning, experiment-based learning, problem-based learning, case-based learning, project-based learning. So the curriculum should include the aspects of these pedagogies so that a complete education on forensic science is given to the nursing students. And some of the components which needs to be included, already there are many included in the curriculum, like forensic photography, nursing and emergency, medical technician responsibility, bite mark interpretation and analysis, death investigation, psychological abuse, deviant behavior and psychopathology assessment, interpretation of blunt, sharp and fast trauma, sexual abuse and rape, jurisprudence, injuries to individuals held in legal custody, elder abuse, child abuse and neglect, substance abuse, psychological and physical abuse from occult or religious practices, and tissue and organ donation. So these are all some of the components which the curriculum has of important forensic values. And components like cultural and traditional practices of people around know the culture and other aspects of people. So that's another important point. An emphasis on human national law. Knowing about Indian law, it will not be sufficient. We must be knowing law too. And focus of transcultural nursing, issues unique to immigrants and refugees, HIV AIDS and its sexual assault, reduce abuse and mortality rate, ethical and moral dimensions of healthcare. So these are all some of the other additional components which needs attention. There is National Forensic Science University Act. There are so many regulations in it. Out of 2020 Act, there are some recommendations which is given. Only selected recommendations I have taken to present here. There must be opportunities for studies, training and research in forensic science, applied behavioral science, criminology, legal studies and other allied areas. As we have seen in the statistics, very less number of institutions are running forensic nursing courses. So there must be more opportunities to educate, train people on. And establishing institutions, departments, laboratories, libraries, Center for Research and Skill Development within and outside the country, like collaborations. So learn from other country, people from other country can come and learn from here. And facilities for distance education. As repeatedly this point is coming, already teachers who are employed cannot go for a regular course. So there must be a provision for distance education for other who have already passed out. Affiliating colleges and institutions for higher learning. If any institution is interested having the facility, Forensic Science University can give affiliation to that. Some of the institutions can be with, they can conduct this refresher courses like public-private partnership in India and abroad, establish offshore campus and outside the country too. And these are all the steps to be followed. I hope I will skip this. This was told yesterday. Next, coming to the practice guidelines. So defining the scope of practice is essential because with that we are clear that under which boundary we work. Like medical legal investigator, clinical forensic nurse specialist, forensic psychiatric nurse, legal nurse consultant, emergency department nurse, sexual assault nurse examiner, forensic nurse educator or consultant, forensic accident examiner or reconstructionist, and nurse attorney. So these are the scope of practice should include this. Other roles to be included in as forensic postmortem examination, forensic traumatology, forensic toxicology, sexual assault cases, member of investigating team, member of insurance companies, member of legal team. And establishing designated posts at government and private sector, because once if you are educated, there must be some job opportunity. Without an opportunity, learning is not useful. Country is needed, at the same time, individual is also in need of. So creating posts are essential. Defining code of ethics for forensic nurses. Job description, clear job descriptions of forensic nurses. Developing forensic nursing protocols. Establishing Indian Forensic Nursing Association. Once some number of people are said Indo-Pacific Academy of Forensic Nurses, if there are more number of people, we may have our own Indian Association of Forensic Nurses, encourage collaborative nursing practices, exchange of knowledge for shared success, and forensic nursing process, application of nursing process in the forensic services. So assessment is equivalent to identification of forensic situation and potential victims. Planning is equivalent to investigation. Intervention is equal to documentation pertaining to the situation, collection of evidence, interviewing, provision of appropriate care, reporting to the appropriate legal agency. And evaluation is post-interview review. So this is the similarities between forensic service with nursing process. Nursing process is the one thing which we can match with anyone. So these are all the steps, actually standard steps which we follow. That is the similarities between nursing process and the forensic service. And R&D, strengthening crime lab and forensic lab with latest equipments, technology, and new technology for scientific innovations. So there are so much research to be done to find out newer techniques, and funding research based on forensic science, very essential. Any research needs fund. Fast and easy methods to identify drugs. So there are the lengthy processes to be cut down. So if we get the reports early, the process also will be early. So these type of activities must be given importance in R&D. I just put a systems model in implementing forensics education. Input, process, output. There is an increased crime rate. There is a need for it. Workforce shortage, need for qualified and trained personnel, need for multidisciplinary team. So the process is establishing facilities, creating infrastructure for faculty training, curriculum planning and implementation, keeping regulations for practice, scope of practice. So the output with this input and process, the output may be better or not satisfactory. With feedback, again it is to be revised till we achieve the goal. Some consequences of having forensic nurses in forensic department. The consequences are classified into positive and negative. The positive consequences include, there is definitely an improved performance that every research study accepts. Better legality of nurses. Basically, we have some legal knowledge. It is already there in the basic curriculum, so that will help to proceed with the proceedings. And calmness of the nurses. Definitely, nurses have a typical qualities of nurses. This calmness, sympathy, empathy will be of helpful. Prevention of patients' rights violation. Many things which is there in forensic nursing is already included in the nursing service only. Advancement comparable with developed countries. There is a reduced cost. There is already someone who is knowing the aspects of healthcare and legal aspects. So it will actually reduce the cost only. An increased accuracy and speed in dealing with forensic cases. Increased performance of legal medicine organizations. Increased employment for nurses. So these are all the positive consequences. Whereas the negative is role conflict with existing forensic team members, and if many people are diverted, that will again lead to nursing shortage. Conflict within the organizations. So these are some of the positive and negative consequences of including nurses in the forensic science. What are capacity building activities required for India? Providing scientific aids to the investigation of crime at the crime scene investigation. Scientific SOPs for lifting, packing and forwarding the crime scene exhibits. Undelayed quality examination of reports and should be available at the investigation stage itself. And practicing and developing technology with all conventional and modern branches of forensics. There is a blending of conventional and modern sciences are required in the investigation process. Provide forensic science quality education. generate preventive forensics to have a check on time and on crime and criminals, and create DVA teams and zone-wise working groups to so making a team of members at the zone-wise will be easy to access the site easily, proceed with the process. So let us consider ourselves not as a finished nurses. We must be learning all our lives. So like this, so many newer aspects of nursing will be added into the ways prepared to new things. Advanced and latest techniques in forensics like microbial forensics, use of AI in forensic. AI has unlimited use in healthcare now. Last 2 months back, we had a seminar on AI in healthcare. We have invited a faculty from NIT Durgapur. So after presentation, she showed a device to us. It's a non-invasive hemoglobin analyzer. So for hemoglobin, every time you have to prick the patient. For this, non-invasive. It is something like a QR code scanner. With our cell phone itself, the device will, you have just press your finger, apply it, then release. It's like a capillary refilling. It will assess and show the hemoglobin level. So it is a validated, tested instrument. It's a non-invasive. So like this, AI itself is a separate topic, but use of it also is upcoming now. It will reduce time, cost, everything, and accuracy, precision in data, useful in AI. Then humanitarian forensics, sir dealt yesterday with this. DNA phenotyping, biosciences for finger analysis. With this, even a very minute analyzed with these sensors. Immunochromatography, geolocating a suspect victim using stable isotopes of water. That means a bodily fluid, unique signature. So this can be analyzed with this technique. Forensic palynology, study of spores, seeds, pollens. Blockchain-based forensic, like cloud forensics. There are so much data stored in the cloud. So that can be utilized for analysis. Digital vehicle forensics. Nowadays, so much hi-fi sophisticated advanced vehicles have come with so much features. That also will be useful for analyzing, like GPS, tracing, favorite locations, all these things. And social network forensics, social media. With the social media itself, lots of evidences are created now. Taken. And 3D technology to determine the physical fit. Drone forensics. So these are all some of the latest advancements. I just wanted to put it as an example here. So with these techniques, when we learn, we must be updating. So learning whatever is in the curriculum will not be sufficient because healthcare is dynamic. It changes every time. We must always update our knowledge on. Some of the recommendations, there should be strong reinforcement, definitely required, and involving all stakeholders and making it a continuous process, and a good leadership, clear understanding of scope of practice. So these are some of the recommendations to make a strong and quality forensic services. We talk about holistic health. When apply holistic principle in forensic nursing services, along with body, mind and spirit, the law is added. So then that becomes a holistic forensic nursing services. So to conclude, I would like to say, developing our making fine observation to recognize evidences and navigate it to solve intentionally or unintentionally execute crime is forensic. Repeat, fine observation to recognize evidences and navigate it to solve intentionally or unintentionally executed crime is forensic. Of nursing services is forensic nursing services. So these are my references. Any questions?
Thank you, Dr. Jaydeepa, for that beautiful presentation. Madam has very clearly explained about all the scope of the forensic nurses in India and what are the shortcomings and what we need to do. If there is any question, you can please ask. Yes, sir. Mike. Mike, can you please give to sir?
Thank you, ma'am, very much. It was a very good presentation, and we enjoyed it. Probably you covered all the aspects of this. A few suggestions supplementing your presentation. That as far as uniform syllabus is concerned, the syllabus at the undergraduate and postgraduate level has been made uniform throughout the India. Now, the Nursing Council of India, the syllabus for the MSc, that has already been approved, so that is a uniform. Yes, it is there. It is there, MSc Forensic Nursing Science. For the PG diploma, it was already there, but recently, the Forensic Nursing Science has already been approved, and anybody can go to the website. Probably they may have added or they may add it later on, but it has been approved. The second thing which I think most important is for developing the forensic nursing sciences, because here I see many principals of the nursing colleges are sitting here. So I will suggest that at least they should set up a separate department of forensic nursing science in the nursing college. Only then the progress will be there, because the person concerned will realize that I have to go further and further, and he will go deep into it, and the things will come out. At least if the department cannot be established in the government institutions, there may be a little bit difficulty of establishing the separate department, but it can be done in the private nursing colleges. There should not be any issue. But the forensic nursing unit can be established. So government does not put a bar on establishing a unit within any department. So that unit can be established, and then that will help a lot in the development of the forensic nursing science. Another important thing is when we get MSc Forensic Nursing Science candidate, when they will complete, then that will be established in a better way. There are few candidates in India which are finding jobs for Forensic Nursing Science. You can give an advertisement, probably they will apply and it will be there. Another important thing is that those nurses who are posted in the emergency, those nurses who can be posted in the mortuary, probably they should have some training from the forensic medicine department, and the practice of the forensic nursing science can start there. And the students who will be coming in the undergraduate level, they can be posted there, and then definitely they will get some experience of the forensic nursing science. So these are just my ideas how this can be further developed. Thank you very much.
Yeah. Mike. Thank you, sir, for those suggestions. I think the situation is similar to just like nurse practitioner course. When it was earlier started, there was a lot of resistance, there was a lot of discussions going on. Similarly, forensic nursing is also in its basic neonatal stage. So it needs a lot of encouragement from all the different sectors of the society. So whenever we are having such type of conferences, we can have collaborations with physicians, with lawyers, with inspectors, so that everybody is aware of that, okay, there is a scope for nurse in this area also. And like you were telling, that we need training also. Maybe at our own level, we can just talk to our experts in the medical colleges that, okay, sir, now the syllabus has been formed. Can you please take a session for us, so like that. So at individual level, if we start doing things, the things will change. So a strong leadership is definitely needed. Yeah, thank you so much about that.
Madam, a wonderful presentation. Congratulations and thanks. Dr. Rakesh has highlighted, there are a couple of points which I want to highlight. The problem in India for nurses is we do not have a scope of practice defined for nurses. after 75 years. Now, we are hopeful with this government, this winter session, a new commission they are going to roll out, and they will have enactment of National Nursing and Midwifery Commission. Commission will have a power to prescribe not only the curriculum and bringing uniformity of nursing education in country, but they will prescribe the scope of practice for nurses at different level. Today, we have nurses trained at A&M level, GNM level, that is diploma, graduate nurses at BSc 4 years degree, and specialized nurses at master's level, and nurses do have a doctoral degree in country. But there is no distinct scope what one can do or cannot do. Second thing is, we have specialists, but unless the government defines the scope and creates the position. Our current Minister of Health, Mansukh Mandavia ji, is very positive about bringing out nursing at forefront and promoting nurses in healthcare delivery system. And I hope under his leadership, we will be able to not only create nurse clinical specialist positions in central government institutions, but such micro specializations. So I think from where we need to begin having a position of sexual assault nurse examiner in each emergency. And then we have these specialists are also, given a certification who can be available for on-call for private hospitals. When such assault patient comes, she as a woman will be well accepted by the victims. She can, collect all the evidence, can prepare a report, and this report can be used in the judiciary system. So I think with this and then existing all emergency and trauma nurses trained as a certification in this forensic nursing probably will be beginning of journey. And then gradually we will have a full-fledged labs and departments as in forensic nursing colleges, and then master's degree. I congratulate Indian Nursing Council for incorporating forensic nursing and undergraduate program, and they are also into pipeline of rolling out MSc in forensic nursing. So I think there's a bright future in scope, but what we need to do is we need to make our associations very strong so that they can lobby, they can speak, and then these things can happen. Otherwise, we will be keep speaking each conferences, and we'll be keep writing these resolutions and sending them, and nothing happens. Once again, thank you, ma'am, and thank you, sir, for highlighting this.
Thank you, ma'am. Thank you, chairpersons, for this wonderful session on forensic nursing in India and globally. Now, for the other session, I would request Dr. Sangeet Dhillon, Professor and Head Department of Forensic Medicine, Dr. Y.S. Parmar, Government Medical College, Nahan. The topic for this session is sharp and blunt injury, wound identification, and evidence collection. So, a brief about ma'am. Ma'am is working as Professor and Head of the Department of Forensic Medicine, Dr. Y.S. Parmar, Government Medical College, Nahan. Formerly, ma'am was working at IGMC as Associate Professor from 2017 to 19. Also worked as Assistant Professor and Registrar. Ma'am has served as Medical Officer at Community Health Centers in Bharadi, Bilaspur and Mandi for more than 5 years. Ma'am has delivered lectures on topics such as forensic psychiatry, forensic toxicology, and treatments, managing the department activities, and getting the examination conducted in forensic medicine. I would welcome you, ma'am.
Let's put our hands together for Chairperson of the session, Dr. Suresh Kumar Sharma. Sir is working as Principal College of Nursing, AIMS Jodhpur, Rajasthan. Formerly worked as Dean and Principal, AIMS Rishikesh. Sir is Masters in Medical Surgical Nursing from PGI Chandigarh, PhD in Administration. Sir is honored with ICN Global Nursing Leadership Fellow 2020, Geneva, Switzerland. Director, International Network of Doctoral Education in Nursing, Indiana, USA. Received more than 11 national and international awards for his excellent work in the field of nursing. Sir has received Florence Nightingale Award in year 2001 and Best Paper Award and many more prestigious awards. Sir has written more than 6 books, edited for 5 books and chapters, contributed for 4 books. Sir has more than 170 research publications in national and international journals. Sir has more than 25 extramural and intramural research grants, 7 non-funded projects. Sir has completed more than 15 national and special assignments and delivered more than 13 keynotes. Sir has chaired more than 60 sessions at national and international conferences, seminars, and workshops. Sir is having more than 16 national and international fellowships in many prestigious universities, societies, and associations. Sir has fellowship and certification with various esteemed organizations, especially University of Melbourne, Australia, Globally Nursing Leadership Institute, Scholar at Global Nursing Leadership Institute, Geneva, Hospital Administration and Management at National University Hospital, Singapore, University of California, San Francisco, USA. We welcome you, sir. Now, I would like to hand over the mic to our resource person, Dr. Sangeet Dhillon, ma'am. Ma'am, please continue with the session.
Good morning and greetings from Government Medical College, Nahan. I'm Dr. Sangeet Dhillon, heading the Department of Forensic Medicine over there. So I start with the thing. May I, sir? Okay, thank you. So sharp and blunt injury, wound identification and evidence collection. So as per the definition, the medical definition is when there is breach of continuity of any tissue of the body, we say it as a medical definition of injury. Next is the legal definition. Now, legal definition is completely different from the medical definition. We say that when there is any harm illegally, so here we are talking the word legally and illegally over here, to a person, to his body, mind, reputation, and property. So here we are not only talking about the body tissue as such, we are talking about the scars which we form lifelong in our mind, right? As to our property, as well as the body also. Next we come to is the mechanical injuries or blunt injuries. Over here, injuries caused by application of physical violence to the body. So here, when we say about mechanical injuries or blunt injuries, this is what comes to the surgery department for treatment. But as such, the definition of injury is completely different in comparison to the injury which we see in the surgery department. Next is the injury. One is the injury can be divided into a causative factor according to the severity, which is simple and grievous. It can be a medico-legal classification when we say that it is inflicted on by own, homicide when it is inflicted by somebody else with a bad intention, then is an accidental injury, then is a defense wound injury. Next come to is the moment of death. So moment of death can be antemortem and it can be postmortem. The further thing is the injury can be caused by various factors, like in mechanical factors we divided into abrasions, a bruise, a laceration, an incised wound, a fracture or a dislocation. And we divide thermal injuries, that is because of heat, excess of heat or excess of cold. That is due to heat, it is burns and scalds. And when we talk in terms of cold injuries, it is frostbite, a trench foot and immersion foot. The chemical injuries are corrosive acids, corrosive alkalis, and further is the miscellaneous injuries, that is self-inflicted, defense injuries, offensive injuries, and fetal and non-fetal injuries. Now, the classification by the causative factors, that is when we say an abrasion. In other terms, it is a blunt impact injury. So that can be abrasion is destruction of the skin which usually involves a superficial layer of the epidermis. So only the superficial portion gets injured in that. That can be because of any hard trauma, it can be any blunt trauma, it can be a rough surface with which we get abraded with. So it can be caused by a stone, it can be caused by a nail, a needle, or a stick. Now coming to the next one, the abrasion, as already said, it is only involving the superficial parts of the skin, the only skin portion which is as such seen by you. So the outer layers of the skin get scratched. So here what happens is there is no scar formation or there is no scar left on the body. And this heals rapidly within few days and leaves no scar over here. The features of abrasion are they are superficial and rarely they go into a deeper tissue. Now how do we get it? We get it by rubbing, by scraping. The causative agents can be a sharp object, if it can be a pen, it can be a thorn, and on the rough surface it can be a road, it can be a ground, it can be a floor. So if in case my dupatta gets attached with one of the buses and I get grazed on the ground, this is typical injury which I get over there. So blunt objects are kicked with the foot, with the boot, we say it as a short foot. Then is ropes, sticks, a whip, or teeth bite. Now the scratches. Scratches is a linear injury. I just rubbed somebody with a pointed edge. That is what we say a scratch abrasion. So caused by a sharp pointed object such as a pen or a fingernail running across the skin. The characteristic thing, you can see it in the diagram. The direction of the scratch is indicated by the sharp edge initially and heaped up epithelium is there. When I scratch somebody, it will be the distal portion where the epidermis will start heaping up. So I can make out what the pattern was and what was the position of the assailant and what was the position of the victim at the time of injury. Similarly, we get grazes, we get sliding injuries, we get frictional burns, or we say that as a gravel rash. Now over here, it is produced when a broad surface of the skin slides against a rough surface like a ground, a road, and we say it as a brush burn in that. Now this is typical of roadside accidents, dragging of a body on a ground, glancing kick with a boot. Next is frictional abrasion. They are caused by rubbing the skin surface with cords or ropes. This is we get in hanging and strangulation. And blows with the lash, friction between a skin and edges of a garment. Now these kind of injuries I have been doing since long, like a hanging and a strangulation. Now at times it becomes very difficult to convince the family members that a person has committed suicide. That is what we say is at hanging. So what they say is, especially in case of domestic violence or where the lady has just got married and within 2-3 months if she hangs herself, the family members are not able to take that she has done this kind of thing, like she has hanged herself. And they always go in for that the case should be registered under that she has been murdered or she has been strangulated to death, right? So this is the commonest thing which we are getting. In case we are having enough of medical knowledge, we will not be making this mistake that we write a hanging as a strangulation or we write strangulation as hanging. Now next thing we come to is the imprint, stamp, pressure, contact, patterned, or a crushed abrasion. Over here, it is produced by a direct impact or pressure without the relative moment. This is typical of a crush injury when we get crushed under an automobile. So there you can see in the diagram, there is a typical tire mark which is present. So this is teeth marks, a ligature mark, or it can be a muzzle imprint. Muzzle imprint is in case of firearm injuries, we get a typical pattern of the weapon, right? Now, in case of medico-legal significance, it provides valuable information about the site of impact and possibility of internal injuries which might have occurred due to the tire marks. Then is identification of object causing the injury, for example, as in case of patent or imprint abrasions, ligature in hanging, and the tire marks in a road traffic accident. The medico-legal aspects is cause of injury. It is the site of abrasion, helps to determine the cause of injury, as if it can be a throttling, a neck injury we get in that. It can be on the nose and the mouth when we try to block the airway of a person. So that is what we say it as smothering. On the thighs and genitalia, sexual assault. For somebody who is having enough of this medical knowledge, will take it as an injury. But for a forensic nursing person, for a forensic expert, it will be completely different. So direction of injury, sharp margins in initial and heaped up epithelium on it, terminates serrated borders initially, and heaped up epithelium at the end will be present. Next is condition of abrasion by time taken. So in case the injury is just lying as it is having a brown color marking over there, we can think that it can be manipulated, or it is a manipulated wound done by the accused or done by the victim. So whereas if it is an injury, it will obviously change its color. So here we have a fresh injury which will be bright red in color. If the time has elapsed between 12 to 24 hours, there will be lymph and blood rise up, producing a bright red scab over there. Next is 2 to 3 days, that is reddish brown scab. 4 to 7 days, epithelium covers the defect under the scab area. And after 7 days, it is a kind of scab which dries up and it falls. And we have the area which has already, new epithelium has already formed over there. Next, we have another injury by the name of bruise or a contusion, and we call it in Hindi as a gum chot also. So that is in bruise or contusion, there is ecchymosis or effusion of blood in the subcutaneous or the submucous tissue by the extravasation of blood due to rupture of capillaries caused by application of hard blunt force. There is no solution or breach of continuity of the covering skin, but the epidermis may occasionally be abraded. So here sometimes what happens is the inside organ is already ruptured and we are not able to see externally any kind of wound. So externally when we see the patient, we say that it might be a normal case of death where the person has suffered from myocardial infarction or he had a heart attack and he has died. But whereas when we open the body, we realize that he's having this kind of injuries. So this is possible in a hard blunt with a hard blunt weapon, and it is by a stone, a stick, or it is by a fist blow. So in this, it can be spontaneous also, so we have to have a medical knowledge also whether this condition is because of any coagulation disorders in the body. That is disease of the blood, vessels, scurvy. Scurvy is vitamin C deficiency, and in leukemia. This is a kind of cancer of the blood. Next we come to is the traumatic injuries. That is blows with the club or fist, kicks, stone and bricks. Firm gripping of a weak person can also lead to contusion formation. The classification of bruises depending upon the depth of the tissue involved. It can be an intradermal bruise, it can be a subcutaneous bruise, it can be a deep bruise where the viscera gets involved, and a deep bruise may become evident after 2 to 3 days. Meaning thereby what I'm trying to tell is that we have to call the patient again for a re-examination, right? Next is we have an ectopic bruise. The injury has been made somewhere else and the bruise is seen. If it is a head injury, it will percolate down and the injury or the contusion will be evident at the back of my neck. So that is a bruise may not be present necessarily at the site of impact. The extravasated blood may move along the tissue place under gravity influence and gets collected at the distance place. Now example can be blow on the forehead or fall on the vertex, a black eye, fracture head of humor, blow on the outer part of the thigh and bruise around the knee. We have something called a spectacle hematoma, which we see as a black eye or a periorbital hematoma, or we also say it as a raccoon sign. A bruise around the tissues of the eye and the eyelids may result in what we say it as a spectacle hematoma. A blow to the orbit, fractured orbital roof, a blow to the forehead, and a fall on the vertex. Next is what we say it as a battle sign. I've already explained that injury has taken place in the upper part of the head, upper back part of the head, and it is seen at the back of the ear. So that is what we say it as a battle sign. There are various factors which modify appearance of a bruise, that is site of injury, vascularity of the area, age, the sex of the individual, color of the skin, nature of this disease, and the gravity shifting of blood. Site of injury, that is, an important sites are areas covering the bones and loose tissue, bruising more marked in area covering the bones without any intervening fibrous tissue. So that is our front portion of the leg. No bony support for abdominal walls. Bruising is rare after physical impacts on the abdomen. Now, absence of bruising is no proof, as I've already said, that there is an undamaged tissue. There is damaged tissue sometimes, and externally we do not get to see any injury present. Next is bruising appears easily around the lax tissue of the eye, the face, and the genital area. Black eye is with the smallest of injury also, with the smallest of blow also, we get a black eye. Bruise formation of scalp is uncommon except in birth trauma in a newborn. And there are rare bruising because of the firmness of the skin on the palm. Now the diagnostic features are shape may correspond the shape of the causative object, reddened area when it is fresh, pain and a swelling might be there. Sometimes the patient comes to us and complains of pain in the area. And externally when we see and we feel it is absolutely normal, there is nothing wrong, and we sometimes take it that the patient is malingering also. Next is the medico-legal significance, indicates offending object, gives idea about the degree of violence, time of injury, motive in throttling, pressure of pads of the finger, homicide, bruise on the back of the fingers, hand and the forearms. Now there are multiple small injuries on the arm just below the shoulder, implicates that the person has been pulled around. Adults in alcoholics and drug dependency, bruising is very common. So at that time we have to think in mind what the basic pathology might have occurred. In child, battered baby syndrome is when we batter the child for a longer time and the child is victimized by his own parents. Next is a tram track bruise, where we hit somebody with a rod, with a stick, or with a whip, and a kind of torture is given. Central repressed pale area with margins showing blood and swelling will be present. Suction fatigue, which is very normal when we do a sexual assault examination of the victim. At that time we get bruising on the cheeks and the breast area, and that is what we say it as a love bite. Next is bruising on the medial aspect of the thigh, vulva and around the anus. This indicates forceful sexual intercourse. Bruising of the cervix shows dilatation of the cervix. The bruising of the buttocks, they indicate torture. Next is due to sudden compression of the subcutaneous tissues, fat may be displaced and enters into the injured vessels, which may lead to fat embolism, and the patient dies after a while. Accidental, common occurrence. Suicidal, not common. It is not easy to inflict a contusion on your own self. Homicidal, it is a commonest finding. We get to see a contusion in that. Self-inflicted, artificial bruising is done by putting a marking nut, or it is also known as calotropis, where the dhobis, which they use a marking nut, it is used by the person so as to inflict or show an injury on himself. Next we come to is a lacerated wounds or injuries. Now these are the wounds caused by a blunt force resulting torn of the skin and the underlying tissues with a minimal bleeding at times. Now the features of a lacerated wound is the edges are ragged, irregular and contused. Margins are abraded due to impact of blunt force. Deep tissues are crushed, hair bulbs are crushed. Less bleeding is present when we compare in terms of an incised wound. Presence of foreign materials might be present. Shape is irregular in formation, and size may or may not correspond to the weapon used for inflicting a lacerated wound. Margins are irregular. Floor, where tissue is present, there are only tags present. Damage to the tissue is gross and extensive. Hemorrhages less because of crushing of the vessels. Foreign substances are present at the lacerated wound. Healing process may be delayed due to the gross damage. And scar formation is usually there in case of a lacerated wound. Next we come to is a types of lacerated wound. So that is a split laceration when I hit a person with a rod and there is only a skin tissue and below that there is another bony tissue present. So if I hit somebody with a rod on the head, it is to produce a split laceration over there. And you might read it as an incised wound. So one has to be careful in judging what a lacerated wound is and what is an incised wound. This is something which we have as a lacerated wound. Next is a stretch laceration. Due to overstretching of the skin, it produces a flap. Due to a blunt tangential impact, when head strikes on the windscreen of the vehicle, due to sudden deformity of the bones after fractures. There is something called an avulsion wound, that is degloving of the skin over the impacted area due to compression and grinding of the underlying tissue. This is commonly seen in roadside accidents and when a person is operating a heavy machinery. There is tears laceration. These are small injuries due to friction with irregular or pointed end of a weapon or an object on the surface of the body, deeper at the string point than at the terminal. So at the starting point of the injury, we will be having a more depth. Cut laceration. This is the type of lacerated wound produced by not so sharp edge of a heavy weapon, seen in chop wounds. Margins are not clear cut and abrasion or contusions are seen on the margins. The medico-legal importance, it can be homicidal, it is usually homicidal. Suicidal, it is very difficult to inflict an injury on yourself. And it can be an accidental and there will be foreign material present in that. The role of forensic nursing, when we talk about all this, forensic nursing is defined as application of the nursing process to the public or legal proceedings and the application of forensic healthcare in the scientific investigation of trauma or death related to abuse, violence, criminal activity, liability, and accidents. The different roles of a forensic nurse is a clinical forensic nurse investigators, sexual assault nurse examiner, forensic psychiatric nurse, legal nurse consultants, nurse attorney, and a nurse coroner. Now over here, I would like to stress upon sexual assault nurse examiner. She has a vital role to play when she has to check a person who has gone through a forceful sexual intercourse which she never wanted to encounter. At that time, sometimes the patients, they go mute. They do not talk for hours together. So we have to really spend time for about an hour or 2 hours sometime asking the child what happened. So in case we have a help of a forensic nurse, it's going to be really easy because treating a child is another task and treating is another task, right? Now is the evidence. Evidence is defined as something that gives proof or leads to a conclusion, which includes documentary evidence, testimony, and the objects which we have to take up. The two types of evidence is testimonial evidence, includes oral or written statements given to police as well as testimony in the court by people who witnessed a particular event. Statement made under oath, what is said in court by a competent witness, and it is also called as a direct evidence. Next we have is a physical evidence, tangible items that tend to prove some material fact, also known as a real evidence. Physical evidence, we go by the principle, there is something called a Locard's law principle. Every contact leaves a trace. So we have to visit the scene of crime at times and we have to pick up evidence from the scene of crime. So the value of trace forensic evidence was first recognized by Edmund Locard in 1910. He was the director of the very first crime lab in existence, that is Lyon in France. The Locard's exchange principle states that with contact between two items, there will be an exchange of material which takes place. Types of physical evidence, there is a trace evidence, there is a transient evidence, there is conditional evidence, indirect evidence, circumstantial evidence, individual evidence, and a class evidence. Now, in case of trace evidence, it refers to physical evidence that is found in a small quantity, a measurable amount such as strands of hair, fibers, or skin cells which are taken up from the scene of crime at times. Transient evidences that can be washed away, damaged, lost, or destroyed either intentionally, accidentally, or environmental factors is designated as a transient evidence. If a particular evidence crime take place at one place, it is very imminent for the crime scene investigators to go over there and pick up the evidence. Because in case it starts raining that very moment only, all this transient evidence gets lost. The conditional evidence is produced by a specific action or event at the scene, must be observed and recorded. Examples, lights, garage doors, windows, position of the body, and position of the furniture. Next is circumstantial evidence is not direct evidence from the witness. It is that we deduce out from the scene of crime, from the victims, and from the lie of things. So that is circumstantial evidence, which is not direct evidence from a witness who saw or heard something, is a fact that can be used to infer another fact. For instance, a witness saying that she saw a defendant stab a victim is providing direct evidence. By contrast, a witness who says she saw the defendant entering a particular house, that she heard somebody screaming, and that she saw the defendant leave with a bloody knife is what we say it as a circumstantial evidence. We have an individual evidence material that can be related to a single source. Individualization always involves a comparison, narrows an identity to a single person, thing. Examples we have as DNA fingerprinting, fingerprints, and handwriting experts. Class evidence is material that can be associated with the group of items that share properties or characteristics. Object is similar to the group of similar objects, but not one single object. Narrows an identity to group of persons or things. Like we say blue jeans. So blue jeans, so many people are wearing at one time. Then is evidence collection techniques. That is either we pick up with the clean forceps. Second is by lifting with the help of sieve tapes. And third is by scraping the area and then taking out that material. It can be by vacuum sweeping the area, that is equipped with filter trap used to recover the trace evidence from an item or area, combing the part from where we want any evidence, clipping the area as we do in case of sexual assault victims. We clip the nails and we try to make out if there is any DNA lying underneath. That finishes my talk of the day. Thank you so much.
Dr. Dillon has wonderfully summarized about blunt and traumatic injury and role of forensic nurses and significance of for the forensic nurses. She began with defining the injury in terms of medical terminology and legal terminology. She spoke about different types of injury, beginning from abrasion, then the other types, scratches, bruises, different types of lacerations, and then she talked about the types of evidences. For nurses, it is very important to understand the type of injury and the way the injury has caused, because when they collect the evidence, when they document the evidence, it is very important to understand about the type of injury and the nature of injury and the type of different evidences and techniques they collect the evidence. So I congratulate Dr. Dillon for a wonderful presentation. Now house is open for questions. If no questions, okay.
Hello. Good morning, ma'am. Thank you so much for a wonderful presentation. I just want to know how you differentiate the wound which is due to trauma and the wound which is caused by assault or any criminal activity.
See, one thing is we go to the basic thing. One information is given by the police personnel to us. One information is what the family members give to us. And third thing is what we are seeing as such on the body. So we pick up everything. We do a video recording of the scene of crime. We see the photographs which are given to us by the police personnel. And then we try to make out what all injuries are present. Every case which comes to me is treated as a homicidal assault or a homicidal death or similar thing until and unless I prove that it is not. So,
And there are many cases where the bodies are unidentified, brought by the police and any other person from the community. So how you think about those persons, what is in your mind to find out the cause of death in those cases?
we are getting multiple type of, like we get unidentified males, females body. We sometimes get bones also for examination. We go by the basic thing that we have to make out whether this particular set of bones or particular thing which has been brought to us, it can be a dismembered body portion also. We try to make out whether it's human or animal. We try to make out whether this belongs to one person because sometimes we get dismembered parts also. So we try to make out whether they belong to one person or not. We try to make out what is the race of the person, that it can be belong to any race. We try to make out the age of the person. We try to see what is the sex of the individual because sometimes the bodies are so dismembered or they are after a long time they are brought to us or they are recovered after a long time. So we try to make out what is the sex of the individual, the age of the individual, the type of injuries which are present on the body, whether they can be homicidal, whether they can be accidental, or whether they are suicidal in nature. And finally, we try to make out since how long the person's body has been lying over there and what can be the cause of death and what is the time since death. Thank you so much.
Do we have any more questions? If no, thank you so much for a wonderful presentation.
Thank you so much.
Thank you, ma'am, for this wonderful presentation. Thank you, sir. So now I announce for the tea break. You'll get your tea at your respective seats. For 15 minutes, we give you the time for tea break and we'll resume back after 15 minutes. By the time we'll arrange our stage for panel discussion.
Hello. 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 Hello.